basal ganglia, internal capsule, and the lateral ventricle of the brain. They are intimately related to each other. Now, in the brain, we can see the grey matter and white matters. Outer grey matter of the cortex and white matter inside. And the grey matter, actually within the grey matter we can find the nerve cells, and within the white matter we can find the fibers. The fibers are of different types, like association fiber, commissural fiber, and projection fiber. Association fibers, they are related, they interconnect the different gyri of same or different lobes. Short association fiber, long association fibers. Then commissural fiber, which helps to communicate the identical parts of the each cerebral hemisphere. And projection fibers, that means they arise from the cortex and goes down, and they terminate as corticonuclear. That means from the cortex to the respective cranial nerve nuclei or other nuclei, and to the spinal cord. That means corticospinal cord. That means we know the pyramidal tracts we have learned in physiology. The pyramidal tract, it originates from the cerebral cortex and goes down, and it forms up to the, it goes down to the spinal cord as corticospinal tract, which controls the lower neurons. So they are the primary upper motor neuron, and from there the lower motor neuron, they connect with the lower motor neuron. Now these projection fibers passes through another area. This is a coronal section of the brain where we can find, this is an area through which the projection fibers actually pass. It is on its medial side we get a grey matter, which is the head of the caudate nucleus, and also we can get another grey matter, that is the thalamus. And on the lateral side we get, this is a biconvex lens-like structure which is called lentiform nucleus, and which has got outer part that is called, that is the putamen, and inner part which is called the globus pallidus, which has got medial and lateral parts. So as a whole, these forms are lentiform nucleus, lens-like, biconvex lens-like structure, that is grey matter, and it looks like, you can, this is convex curvature. Here you can assume there is another convex curvature here. So it is biconvex curvature. It consists of two regions, one lateral region, that is a putamen, and the medial region is the globus pallidus. So at this one, and along with this, the caudate nucleus, they are actually located within the, we can see This is the cerebral cortex, here the grey matter, then inner white matter where we can find the fibers are coming. So here this area and this area they are present in subcortical region below the cortex. So it is called subcortical grey matters. So these subcortical grey matters, caudate nucleus or head of the caudate nucleus, then this putamen and the globus pallidus, which as a whole it is called as lentiform nucleus. Then below the thalamus, this is thalamus, we can find another region which is called subthalamic nucleus. Lateral to this lentiform nucleus, we can find another grey matter, that is a claustrum. So as a whole they form the basal nuclei or basal ganglia. And also there is another part which is not visible here, which is present in the midbrain. When we cut the midbrain, we can find another region, that is a substantia nigra, black, which on cross section it appears as dark region, which is called nigra, that is black color, as substantia nigra. So that part plus all these nuclei we can find, claustrum, lentiform nucleus, caudate nucleus, subthalamic nucleus, substantia nigra, they constitute the basal ganglia. In the cross section we will find the basal ganglia. Now the basal ganglia has got this part, this is called putamen. This putamen and this head of the caudate nucleus, they are connected with each other, okay, through which the fibers are coming. These fibers constitutes the internal capsule and they are connected with each other through the fibers of the internal capsule, okay, which are called the com fibers, and ultimately they are related. As a whole, this part and head of the caudate nucleus, this part is called neocortex. But that the part that is the corpus as a whole, it appears as a striated material because the fibers are coming, and here there is a communication. There are also the connections. So as a whole, there is crisscross pattern of fibers. Like when we comb our hair, so that pattern is generated, which is called and gives a striated appearance. So as a whole, this putamen and the head of the caudate nucleus, it is called, they are corpus striatum, they are part of the corpus striatum. Okay. And they are called neocortex. And this globus pallidus, they are if we look at the evolution, their origin is very primitive. So they are called paleo, means old, paleostratum. So this, or that is a pallidum, globus pallidus, pallidum, neo, and that is paleo means old. So it is called paleo. That is the globus pallidus. It is the paleostratum, neostratum and paleostratum. Okay. Now this globus pallidus is medially placed. As a whole, it forms the lentiform nucleus, that is putamen and the globus pallidus. As a whole, it it constitutes the lentiform nucleus, and putamen and the caudate nucleus, they form the input centers. They are the major input center of the basal ganglia. Inputs are coming from where? It is coming from, it can come from the thalamus, it can come from the cortex, centripetal and centrifugal connection, afferent and efferent connections are there. So ultimately it will reach from the thalamus. Suppose, what is thalamus? Thalamus is a part where it is a relay center. All the sense of the body except the sense from the face, facial region, it comes to this area. That means from the dorsal column or from the spinothalamic tract, okay, or from the dorsal column, that is we have definitely have some idea in the dorsal column nucleus, nucleus gracilis, nucleus cuneatus, or if you don't have any relation, just remember the senses are passing through the dorsal column of the spinal cord, and it reaches into some nucleus. From there, ultimately it is carried to the thalamus. Okay, all the senses, and from the thalamus, ultimately it will reach to the cerebral cortex. Now, during its journey, it will relay into in the putamen and the caudate nucleus, because they are the input centers. Okay, the impulse will come to the putamen and the caudate nucleus. From the caudate and nucleus and the putamen, this information will be carried forward to this area, that is the globus pallidus. And ultimately the medial part of the globus pallidus is the output center. From here it will reach to the cerebral cortex. So why it is needed? Because there are, from the cerebral cortex, corticospinal fibers are coming down, motor fibers from area 4 of Brodmann's area. We know there is motor area which is present in the precentral gyrus. There is a motor area. From there, the corticospinal fibers are coming down. Yes, but the command is there, but already that our cerebral cortex has given a motor command. Suppose we have to move the hand. Okay, we like to move the hand. We have to, so the particular muscles will move. But that movement needs again vigilance by some other structures. That means that movement will not be very smooth. There's a gross movement we can expect. Okay. But that movement will be monitored or coordinated by these basal ganglia. Because from here, actually, from the cortex, it will reach to the putamen. Again, from there, it will reach the medial part of the globus pallidus, and that will be integrated, and ultimately it will come to the thalamus, or it will come to ultimately it will reach to the cerebral cortex. So that movement will be monitored and coordinated by this the basal ganglia. They are also Not only the pyramidal fibers, that means corticospinal fibers, corticonuclear fibers, they are causing the movement, the motor movement. They are also responsible for the coordinated motor movement. Coordinated motor movement. So, what will happen if this region is affected? Okay, due to the cerebral hemorrhage or cerebral infarction, that means when there is a catastrophe in the vascular system of the brain, what will happen? The basal ganglia will be affected. So there will be what are the features? Rigidity, the clock knife rigidity. Movement will be there, but there, and bradykinesia, that means lack of movements. And if there is movement, there is a whole muscle. If you feel, there will be rigidity, bradykinesia, and tremor. These are three cardinal features of lesion of the basal ganglia. Okay. So, next is this area which is called the internal capsule. And before that, you can see one area on either side of the midline. What is this? This is a cavity. That cavity contains cerebrospinal fluid. So that cavity is lateral ventricle. Okay. Now, before that, we can I should describe a little bit of the basal ganglia, because this is the head of the caudate nucleus. If there is a head, there should be a body and tail. So this figure will show you the head of the caudate nucleus, which has got the body. Okay, it goes behind, and it is then continued as the tail, and ultimately it ends in the amygdaloid body. So this head of the body actually is it becomes a head of the caudate nucleus becomes body, then the tail, it looks like a C-shaped area. C-shaped area. And this C-shaped area, you can see this is within the brain, that cavity is called the lateral ventricle, which is also a C-shaped area. And it is continued along with the lateral ventricle, and it will reach up to the roof of the inferior horn of the lateral ventricle. You can see this is the head, and the body, it is within which forms the floor of the lateral ventricle. This is the lateral ventricle. The dot lines are the body of the lateral ventricle. So it forms the floor of the lateral ventricle. Then it goes backwards, and it is continued as the roof of the inferior horn of the lateral ventricle. And ultimately it ends in the amygdaloid body. Okay, amygdaloid body. So as a whole, this structure is a part of the basal ganglia. And you can find also one thing is in relation to this, the caudate nucleus. Okay, that is the thalamus. From the thalamus, the fibers are coming up or fibers are coming down. Okay, so it reaches the cerebral cortex. This forms the corona radiata. Affection of the basal ganglia is a Parkinson's disease. What are the features? Bradykinesia. There is less movement of the face. If there is any excitement within the person, it is not manifested in the face, because there is least movement of these muscles. So it is called mask face. Whatever is there, they are very bad examiners, because whatever answer you are giving to that person, if it is right, you can get the expression of that examiner, and if it is wrong, you will get another expression. But in the mask face, you will not find any expression. Whether you are right or wrong, it cannot be assessed. Okay, mask, the face is very important. That is the mask face. There is hardly any movement. And this is the disease where there is lack of initiation of the movement. Because this basal ganglia is called also the extrapyramidal motor system. The motor system is not only the pyramidal tracts. So they are the extrapyramidal part which is concerned with the motor system. So extrapyramidal system. And here we can find there is lack of initiation of the movement. The patient will remain all throughout the day within a chair or in the bed. There is lack of initiation of the movement. And there is less movement, which is called bradykinesia. Then you can see there is a tremor which is called resting tremor, which are of different types, like drum beating tremor or pill rolling type of movement will be there. It is not intentional tremor. This is resting. All throughout the rest, you will get movement of the head, nodding of the head, nodding of the fingers like this. You might have detected this type of features in some person. Continuous movement. And in some English literature, it is also written, okay, about some person. Okay. So this is the resting tremor. But when the person is engaged in any activity, tremor gets vanished. You will not get the tremor. So if you see a surgeon which is shaking his hand, you might get nervous. How he or she will operate. But during operation, there will be no tremor. Absolutely. When there is initiation of movement, the tremor will get vanished. Next is the short shuffling gait. The person moves like this. Short shuffling gaits. And if you feel the muscle tone, there is all throughout, you can find the rigidity. It is like clasp knife rigidity. You have seen the clasp knife when you are shaving in a salon, the clasp knife. First, the clasp knife rigidity is there. That is the feature of another disease. Initially there is a rigidity, but suddenly it opens up. This is called clasp knife. That is present in other diseases. But here we will see the cogwheel rigidity. All throughout the flexion or extension, you can find there is a resistance. And that is called cogwheel rigidity. Okay. Clasp knife rigidity is seen in case of cerebrovascular accident. And cogwheel rigidity or lead pipe rigidity. Okay. And the treatment is by dopamine supplement. Actually, this nigrostat from substantia nigra to the putamen or the globus pallidus, there is a pathway which is called nigrostat from the substantia nigra of the midbrain to the to this area. This is called nigrostriate pathway. Here the dopamine is the neurotransmitter that gets depleted. So dopamine supplementation will improve this situation. Now about the lateral ventricles. There is a ventricle cavity within the each cerebral hemisphere. Okay. So which is present from the frontal lobe, then parietal lobe, then occipital lobe, and ultimately it reaches the temporal lobe. So it has got a C-shaped area. You can find this is the shape of the lateral ventricle, which is present within each cerebral hemisphere. This is present in the right and this is present in the left. One is present in the right and one is present in the left cerebral hemisphere. And they communicate with each other with this area, which is the gap foramen of Monro. Okay. And it enters into the third ventricle. From the third ventricle, there is another communication tract which passes through the midbrain and reaches the fourth ventricle. So we are concerned with the lateral ventricle. This lateral ventricle you can find, this is the anterior part, it is called, this is a horn-shaped area, horn. You can see this is another horn-shaped area, this is another horn-shaped area. This is called anterior horn, this is called posterior horn, this is called inferior horn, and rest of it is called as the body of the lateral ventricle. So this anterior horn is present within the frontal lobe, frontal and part of the parietal lobe. Body is present within the parietal lobe and the posterior horn is present within the occipital lobe, and this inferior horn enters into the temporal lobe. Okay. So we will find this cavity or the lateral ventricle within the viscera. Now this is the shape. So again it is anterior horn, this is the central part of the body, this is the posterior horn, and this is the inferior horn. So now if we do the cross section on the central part, what we can find, it has got roof, it has got floor. In the roof we can find the corpus callosum. In the floor we can find two nucleus. One is thalamus medially and caudate nucleus laterally. And in between there is a groove which is, and where we can find a vein. Okay, that is the thalamostriate groove and within and thalamostriate vein. Okay, and medially we can find the division between the two ventricles, that is the septum pellucidum. Okay. So this is the central part. This is the part of the anterior horn which is present within the frontal lobe. So within the front, if it is the cross section of the anterior horn, what we can find, it has got roof. Roof is formed by the genu of the corpus callosum. Okay, and this is the floor. Here we can find the head of the caudate nucleus laterally, and below it is the continuation of the corpus callosum. Corpus callosum is like this. This is the genu, this is the rostrum. So rostrum also is continued below in this region, and on either side we can see the anterior horn. Now about the posterior horn, which is present within the occipital lobe. This is the cross section of that area. This is the posterior horn, and here we can find two indentation. One above, on the medial side, we can find one, there are two indentation. It is caused by the fibers of the coming from the corpus callosum, which is called the forceps major fibers, and this indentation is caused by the calcarine sulcus. What we have seen, which is the complete sulcus, which creates an impression within the medial wall of the posterior horn, which is called calcar avis, and roof and lateral wall is formed by the corpus callosum fiber, which is called the tapetum. এবার চলো এটা চলো ওই ল্যাটারাল ভেন্ট্রিকল হয়ে গেছে আমাদের। Now about the internal capsule. This is the last one. Okay. What is internal capsule? The projection fiber. The fibers are coming from the cortex and travels through the brain, and ultimately it reaches to the spinal cord. The fibers from the right side, it crosses at the level of medulla and goes to opposite side. Similarly, from the fibers from the right side, it decussets or crosses the midline at the level of the medulla. The most of the fibers, 75 to 80% fibers actually crosses and goes to the other side. And now we can find this area. So this is the coronal section, or this is the horizontal section. Basically, you can find the most medially, this is gray area, that is the caudate nucleus, and this is the thalamus, okay, behind. And laterally we can find the lentiform nucleus, okay. So in between, through this area, actually the fibers are coming down, passing down, and this is the anterior limb of the internal capsule. This bent is called the genu, and this part is called the posterior limb. And behind we will get other parts. We will see it in other figure. Okay, that is called retrolentiform and sublentiform part. So as a whole, it looks like a boomerang. Okay, actually through this area, actually fibers, cortico-spinal fibers and cortico-nuclear fibers. On the cerebral cortex, the fibers are coming down and reaching the spinal cord or into the cranial nerve nucleus. Okay, there are several cranial nerve nucleus. Okay, optic nerve, nucleus, olfactory nerve nucleus. There are, or oculomotor nerve nucleus. From there, it is reaching to those nucleus, or it is reaching into the spinal cord. So cortico-nuclear or cortico-spinal fibers, they are passing through this area. So this is the area which is called the internal capsule. Actually, this is, what is internal capsule? They are the projection fiber. Pyramidal fibers are coming from the frontal to spinal, or from the frontal lobe to pons. First it reaches the pons, frontopontine. From the parietal lobe, it reaches first into the pons, parietopontine, temporopontine, occipitopontine. These fibers are coming down. Okay, so this is the projection fibers are coming down. Now this appears to be a very small area. But within this area, there are so many nerve fibers. So simple affection of small area will create widespread effect. Okay. So this is the anterior limb, this is the genu, this is the posterior limb, and there are some other parts, that is the retrolentiform and sublentiform nucleus. This is a very good schematic diagram where we can find this is the most medially there are two nucleus, one in front, that is the head of the caudate nucleus, and behind this is the thalamus, and on the lateral side we are getting the lentiform nucleus, that is the putamen and the globus pallidus, and this is the area which is called the internal capsule. So internal capsule has got anterior limb, this is the genu, this is the posterior limb. Okay, and behind this lentiform nucleus you can find these fibers are passing. This is called the sublentiform part of the internal capsule. Anterior limb, genu, up to this is the posterior limb, and this is called the retro means behind. So behind this lentiform nucleus, so this part is called the retrolentiform nucleus. Okay, and through this retrolentiform nucleus we can find some fibers are passing, and we can find other two nucleus which are the part of the thalamus, which are called the medial geniculate and lateral geniculate body. We know the optic tract, it ends in the lateral geniculate body. From the lateral geniculate body, the fibers are coming and ultimately reaches the occipital cortex. Okay, so this fiber is called the optic radiation. From lateral geniculate body, these fibers goes to the occipital cortex. They are known as the optic radiation. So, and this part passes through this retrolentiform part of the retrolentiform part of the internal capsule. Internal capsule, again, this is anterior limb, this is the genu, this is the posterior limb, and this part behind the lentiform nucleus, this is called retrolentiform nucleus, through which we can find this is the optic radiation is passing. So we can find this is retrolentiform part. And another nucleus we can find below this thalamus, this is a medial geniculate body, and from here the fibers are coming and passing below this lentiform nucleus, and it is going to the, where it is going? The medial geniculate body is concerned with hearing, so it will reach the temporal lobe. Okay, so this is called, these fibers are called the auditory radiation. Okay, auditory radiation. From the vestibulocochlear nerve, the cochlear component, it reaches up to the medial geniculate body. From there, these fibers are passing below this lentiform nucleus, below this lentiform nucleus. So it is called the sublentiform part of the internal capsule. Actually, they are the fibers. Now, this is the anterior limb. Through the anterior limb, what I told you, there is a connection between the putamen and the head of the caudate nucleus. Okay, there is dot lines. There is a connection. It is as a whole. It is one part, which is called neostriatum. Okay, and this is old or paleostriatum, which is a globus pallidus. Now, This is the anterior limb. Through the anterior limb, which fibers will pass? There are so many fibers. Some fibers are coming from the cerebral cortex, which are called and going to the periphery. They are called centrifugal fibers. Some fibers are coming from the periphery to the cerebral cortex. They are called the centripetal fibers. So, some centrifugal fibers and some centripetal fibers. They are passing through all throughout this internal capsule. Some centripetal fibers coming towards the cerebral cortex. From where? It is coming from the thalamus. Because all the centripetal fibers first relay center is the thalamus. From the thalamus, it moves through this internal capsule, whether it is anterior limb, genu, posterior limb, latero or sublentiform. So, they are coming from the thalamus, passes through this internal capsule. They are called the centripetal fibers. Actually, I told you from the thalamus they are coming. From anterior part of the thalamus, anterior thalamic radiation. From the superior part, superior thalamic radiation. From the posterior part, posterior thalamic radiation. Okay. So, from the anterior limb, actually the anterior thalamic radiation will pass the centripetal fibers, which are coming from the thalamus. Okay. This is the thalamus. From the thalamus, some fibers are coming from the anterior part. These fibers are passing through the anterior limb. From the superior part, they are passing through the genu and posterior limb. From the posterior part, the posterior thalamic radiation passes through this posterior limb. Okay. So, they are the afferent fibers. Afferent, going towards the cerebrum. They are the afferent fibers. From the cerebrum, the efferent fibers. That means corticonuclear fiber or corticospinal fiber. This is the anterior limb through which the corticobulbar fiber or corticonuclear fiber, the same thing. Corticobulbar means the nuclear. The corticobulbar or corticonuclear fibers passes, and also the fibers of the fibers meant for the head and neck region, they are also passing through the anterior limb. Okay. Now through the genu, the corticonuclear or the corticospinal fibers are passing. And this is most important, that is the posterior limb. Why? The corticonuclear fibers for the lower limb, trunk, upper limb, all are passing through this area. So, affection of this area, if it is right side, ultimately fibers will go to the left side. So, what area will get affected? Suppose this is the right cerebral hemisphere or right cerebral, within the right cerebral hemisphere, this posterior limb is affected. Then what will happen? The upper part of the face, upper limb and lower limb will get affected. So, patient will, what will be the effect? There will be hemiplegia of other side. Okay. If the right side is affected, then opposite side, that means the left side will be, the left side upper limb and lower limb will be affected, and we cannot, there will be a paralysis. Because this is the upper motor neuron, these corticonuclear fibers, they are called the upper motor neurons. And the peripheral nerves which are coming, that is the lower motor neurons. Because upper motor neurons, they control the lower motor neurons. If upper motor neurons, they are passing through this area. This is the posterior limb. So, what will happen? There will be hemiplegia. So, posterior limb is very important. I will show you the blood supply. There is the middle cerebral artery is there, and within the middle cerebral artery, there is middle cerebral artery has got central branches and cortical branches, which passes to the cortex and some passes to the center part of the brain. The central part again divides in, gives medial and lateral branches, and the lateral branch is very important, that passes through this area, this posterior limb, and is very much, and one of the artery is very thick, and that is called the Charcot's artery, and that gets affected. Either there is a clot formation within the artery, which causes the ischemic changes within the brain, or the blood vessel sometimes ruptures, which causes the hemorrhage. So, whatever might be the types of affection, whether it is hemorrhage or the clot formation, thrombus formation, okay, that is that other side of the body will get affected. Okay, that is called hemiplegia. So, this is the nice picture where we can find this is the internal carotid artery, okay, which divides into anterior cerebral and middle cerebral, and this is giving another artery which is called posterior communicating, and this is the basilar artery which divides into posterior cerebral artery. Okay, so we can find this internal capsule. Okay, this internal capsule is supplied by these arteries. This anterior limb is mostly supplied by this anterior cerebral artery, and also one artery is very important, which is called Hubner's artery, which supplies this area. Okay, so this is very important. This supplies the anterior limb. Now, genu is been also supplied by this anterior cerebral directly from the internal carotid artery and also from the medial cerebral. Okay, so this is the supply to the genu, and this is very important. That is the posterior limb, which is being solely, mostly supplied by, this is the middle cerebral, which is lateral and medial branches of the medial, lateral and medial striate branch of medial cerebral, okay, which is called Charcot's artery, and posterior limb is supplied by several arteries, like from the posterior cerebral artery, from the another branch which is called anterior choroidal artery, which is a branch from the direct branch from the internal carotid artery, which supplies this area. That is the posterior limb of the that is the posterior part of that is the retrolentiform and sublentiform part of the internal capsule. Okay, so the major supply is by this anterior cerebral, medial cerebral and posterior cerebral. They are supplying the anterior limb, genu, posterior limb. This is the retrolentiform and this is the sublentiform part of the internal capsule. This blood supply is very important. It will come in alternate year. Blood supply to the internal capsule, because in the clinic we will find the hemiplegic patients. Hemiplegia. Okay, right. Cause of the hemiplegia, we have to diagnose etiological diagnosis. Which is the cause is called the etiology. Etiological diagnosis is affection of the cerebral artery, that middle cerebral artery or anterior cerebral artery or posterior cerebral artery. If I superimpose, then you can have some idea. Okay, this is the corpus callosum. This is the corpus callosum. This is right side, this is left side. This is the this is the septum pellucidum, and it will enter into the lateral ventricle. Lateral ventricle, that part which is anterior, which is called anterior horn. Okay, then within the frontal and parietal lobe, majorly in the parietal lobe, you will get the body. Okay, and in the then another part we will get within the occipital lobe. Okay, that is the posterior horn, and it will enter into the another part will enter into the temporal lobe. So like C shaped. Okay. Okay, C shaped. The anterior horn, body, posterior horn, and this is the inferior horn. Okay, inferior horn is within this temporal lobe. Okay, so this is the anterior, this is the body. If we go behind, this is the posterior horn, and then if we reach more inside, and it will reach into the temporal lobe. So that is the lateral ventricle. Lateral ventricle, this is the opening which is called the foramen of Monro, and enters into this area. This is the third ventricle. This is the area which is called the third ventricle. Okay, behind this area is the thalamus. Okay, and this is the sulcus, which is called subthalamic sulcus, and ultimately through the third ventricle there is a communication. There is a tract which passes through this midbrain, and it reaches into the fourth ventricle. So this is the ventricular system of the brain. So lateral ventricle has got. So if we see, if we want to have some idea about the anterior horn, the roof is formed by the corpus callosum. Floor is formed by the rostrum. Floor is formed by the rostrum. Okay. Okay. Roof is formed by the corpus callosum. So if we see, this is the floor of the central part. Okay. And within the central part, we can find two structures, one lateral and one medial. Within the central part, this is in the central part we are getting the roof is formed by the corpus callosum. On the floor, one is laterally and one structure is medially. The lateral one is the body of the caudate nucleus. Okay, it passes like this C shaped. This becomes the head in front. Okay, the head ultimately continued as the body, and it forms the tail, and it will reach into the temporal lobe. Okay, within the inferior horn. Within the inferior horn, it will form the roof. So on the lateral side of the body, the floor is formed by the caudate nucleus, and medially formed by the thalamus. And here we will get the thalamostriate vein. I told you this is a part of the caudate nucleus is a part of the basal ganglia. So which is called the striatum. So there is a group. This is the thalamostriate group, where we will get the thalamostriate vein. Okay. So this is the central part. This is a thalamostriate vein. Okay. Now this is, we have made another section here at the level of lateral sulcus. Lateral sulcus. This is the lateral sulcus. Lateral sulcus টাকে damage করেছে. This is the lateral sulcus. Okay. At the level of the lateral sulcus, we made another section like this. So here it is very much, now we can identify these structures. First, in front, this is the caudate nucleus. Behind, this is the thalamus. So head of the caudate nucleus, and this is the thalamus medially. Laterally, we can find this lens-like, biconvex lens-like area, which is called the lentiform nucleus. Okay, and in between we are getting this boomerang shaped area. This is the internal capsule. This is the internal capsule. Okay, so through the internal capsule, fibers are either it is entering or it is leaving. Centripetal fibers and centrifugal fibers. From the thalamus, it will reach into the respective cortical area, anterior, superior, posterior thalamic radiation. So this has got anterior limb, this is the genu, this is the posterior limb. Okay, and this is the this is the retrolentiform part, is going to the occipital lobe. Okay, so this is the retrolentiform part, and another part will go retrolentiform part. Okay, this is called optic radiation. So anterior limb, genu, posterior limb, and here from the thalamus, the lateral geniculate body, this is optic radiation is coming. So this is a retrolentiform. Behind the this is the lentiform nucleus. So it is behind the lentiform nucleus. So this is the optic radiation from the lateral geniculate body. That is optic radiation is going to the occipital cortex. Okay, another more medially, which is not actually, it is cut, and it will pass below the lentiform nucleus and will reach to this temporal lobe. So that is called sublentiform part of the internal capsule. Okay, that is the auditory radiation, and which is present more medially. Okay, because this is the thalamus. Okay, thalamus is cut, and it is at this level only optic radiation is available, we can find. So the auditory radiation is more below. So from here, the another radiation will pass, and it will pass below this lentiform nucleus and reach the temporal lobe. Okay, because this is not the temporal lobe. Below this, there is a temporal lobe. Okay, below this, we can reach the temporal lobe. Okay, so that is not visible here. So now this is the lentiform nucleus. So lateral part is the putamen, medial part is the globus pallidus. The lateral part, this lentiform nucleus has lateral part, this is the putamen, and this is the globus pallidus. এই যে এটা দেখতে পাচ্ছ তো, this is the lentiform nucleus, lens like biconvex, এটা convex, এটা convex, and here we can find in front caudate nucleus, head of the caudate nucleus. Behind we are getting, this is the thalamus, and here we are getting this lentiform nucleus laterally, and in between we can find this area is the internal capsule, and outside this one we can find the external capsule. This you can find another area, white matter, which is called external capsule. Okay, and more outside we can find another gray area which is called claustrum. This is not much visible in this one. Caudate nucleus, thalamus, lentiform nucleus. Okay, lentiform nucleus. Clear? This is the just white matter outside this lentiform nucleus is called the external capsule. Okay, and then this area is called the claustrum. This area outside this is the claustrum. Okay, and most outside this area is the part of the insula. This is the lateral sulcus. This is if we remove this area, we can find this is the insula. Insula. This is the lateral sulcus. If we retract the lateral sulcus, we can find another lobe. This is the insula. So this is the internal capsule, lentiform nucleus, then external capsule, then claustrum, and over the claustrum there is extreme capsule, and most outside this is the part of the insular cortex. This is head of the caudate nucleus. Okay, how you can find here? Caudate nucleus, thalamus. Okay, clear? This is on the on this side, and this is another side. So here we can find the thalamus and the caudate nucleus. Similarly, here we can also find this is the caudate nucleus, this is thalamus, and here we can find the lateral ventricle. Okay, lateral ventricle. This is the anterior part, anterior horn. Okay, part of it is anterior horn. This is present within the posterior horn. Okay, it is present within the occipital cortex. Okay, this is the posterior horn. Okay, in the posterior horn we are getting an indentation of the calcarine sulcus. পাচ্ছি ক্যালকারাবিস তো যাকে বাদ দাও এটাকে আমি দেখতে চাইছি this is the posterior horn, this is the anterior horn. Okay, central horn is visible within here. Like this. এটা এটারই পার্ট বুঝছো? ওকে সেম লোক এ দেখো। So this is the দেখো this is the caudate nucleus in front. এ দেখো this was like this, thalamus, caudate nucleus. So if we remove it, this is the caudate nucleus, this is the thalamus, this is the lentiform nucleus, this is the internal capsule. Okay, and over this area this is the external capsule, and then again the gray area which is called the claustrum, and most outside this is the extreme capsule. And if you go more outside, you can reach the insular cortex from midline to outside. Again I am repeating, caudate nucleus medially in front and medially behind. This is the head, this is the thalamus. Okay, then we are getting this area, this is This is the internal capsule. তারপরে internal capsule. Then we are getting the lentiform nucleus. Over the lentiform nucleus, this is the external capsule. More outside, this is the claustrum, and more outside, the white line is called the extreme capsule, and this is then we can reach the insula. এটুকুনি বুঝতে পেরেছো তো? So anterior horn, posterior horn. তো আমরা ওটার সাথে এটাকে করে দিই। কোথায় গেল ওটা? Like this. Now we can have some idea. Okay. So this is the posterior horn. Posterior horn. Reach করেছি। এই যে posterior horn, এই যে posterior horn. Posterior horn. Okay. Clear? Posterior horn. So this is the posterior horn, this is the anterior horn, this is the central part. দেখো হাত দিয়ে এবার কোরিলেট করো the brain. This is the lateral sulcus. If we remove the lateral sulcus, we reach the insula. You can see the brevia longa. That is the gyrus longa gyrus brevia. Okay, I will not describe it. Okay, this is the insula. Insula cortex was on the surface, but due to development of this other parts of the brain, it has submerged inside. So brain has got frontal, parietal, occipital. This is the temporal, and this is the insular lobe. Okay. So where we can get the inferior horn? Then if we want to see, we have to open this area. That is the temporal lobe. Then we can find it is continued as inferior horn. The inferior horn. Okay. Is continued. Anterior horn, posterior horn, central part here. Okay. Central part is here. This is the posterior horn, and here we are reaching the inferior horn. Clear? So this is the lateral ventricle. So lateral ventricle is separated from each other by the septum pellucidum. So this is the opening, this is the foramen of Monro, and this foramen of Monro is, you can see another thing, this is a fornix. Okay, this is another projection fiber. So this is the anterior limb of the fornix, forms the anterior boundary, and thalamus forms the posterior boundary of foramen of Monro. This is the foramen of Monro. Okay, so it is bounded in front by the anterior limb of the fornix, and in front and behind by the thalamus. And this is the subthalamic sulcus, which divides the thalamus and hypothalamus. ঠিক আছে? And similarly, on this side of the brain, the same thing, which is also present, but we have cut it to open this area, that is the basal ganglia region. So basal ganglia has got internal capsule is projection fiber, is passing in between. Okay, in between. Okay, so in front we are getting the caudate nucleus, the head of the caudate nucleus, which is continued as the body, and it will reach where it will reach. It will reach into the temporal lobe, which will form C-shaped area, and it will form the roof of the inferior horn. Inferior horn is not visible. Okay, so this is the caudate nucleus, this is lentiform nucleus. Lentiform nucleus has got lateral part, which is called the putamen, and this is the globus pallidus. And there is a connection between this caudate nucleus and the lentiform nucleus, and this forms the neostriatum. And that means new, and this is the paleostratum. There is a okay, globus pallidus. So in between we are getting the boomerang shaped area, that is the internal capsule. Okay, through the internal capsule all the fibers are passing down. ঠিক আছে? So this is the internal capsule. Okay, this is the internal capsule. So this is the posterior limb, rather the posterior limb of the internal capsule. This is genu, anterior limb. Okay, this is the sublentiform part. Retrolentiform part. Okay, this is a lens. Behind this you are getting another fibers. This is the retrolentiform, behind the lens, behind the lentiform nucleus. So it is called retrolentiform nucleus. And another is more below, from here, okay, from medial side it will reach to the temporal lobe, which is called sublentiform nucleus, below the this lentiform nucleus. Okay, another from the medial there are two bodies, lateral geniculate body through which the optic radiation, and from the medial geniculate body auditory radiation will pass below this lentiform nucleus and will reach the temporal lobe, superior temporal gyrus. Okay, হবে তো? Anterior limb, genu, posterior limb, sublentiform part, and from the thalamus এখান থেকে, from the medial part of the thalamus, sublentiform nucleus, sublentiform part. ঠিক আছে, দেখো নিয়ে। So this is the claustrum. এটা আরো শুকিয়ে গেলে আরো পরিষ্কার হবে, ভেজা ভেজা আছে তো এই claustrum দিস এই এরিয়াটা। দেখো এটার সাথে এটাকে মিলাও, এটার সাথে মিলাও, না মিলালে কি করে হবে, তাই না? thalamus, caudate nucleus, at the thalamostriate groove, এটা এখানে তোমার হ্যাঁ thalamostriate vein থাকে। ওকে, এটা গিয়ে পেছন থেকে গিয়ে রেড সেরিব্রাল ভেন করে, thalamostriate vein কোরয়েডাল ভেনের সাথে মিশে রেড সেরিব্রাল ভেন হয়ে এখান দিয়ে বেরোয়। ইন্টারনাল সেরিব্রাল ভেন, এই দুই দিককার ইন্টারনাল সেরিব্রাল ভেন এখানে গেট সেরিব্রাল ভেন হয়ে বেরোয়, বুঝেছো? thalamostriate vein আর কোরয়েডাল ভেন এই দুটো মিশে ইন্টারনাল সেরিব্রাল ভেন এখান থেকে গেল অফ দিস সাইড, আর ইন্টারনাল সেরিব্রাল ভেন অফ দিস সাইড, ইট উইল ফর্ম দিস তোমার আলটিমেটলি তোমার গ্রেট সেরিব্রাল ভেন অফ গ্যালেন, গ্রেট সেরিব্রাল ভেন অফ গ্যালেন। এটাও দেখো একই রকম, দেখো সেপ্টাম পেলুসিডাম, দেখেছো? এই দেখো সেপ্টাম পেলুসিডাম, এই যে এর অ্যান্টিরিয়ারলি দেখো, অ্যান্টিরিয়ার লিম্বটার এই অ্যান্টিরিয়ার হর্ন আছে, তার বাউন্ডারি দেখো অ্যান্টিরিয়ারলি দেখো এই আমাদের কর্পাস ক্যালোসাম, আবার তলাটা এরকম করে কর্পাস ক্যালোসাম ফর্মস দ্য ফ্লোর। ওকে, ঠিক আছে, দেখো part of the lateral ventricle, ঠিক আছে? এটা এটা বেস অফ দ্য ব্রেন, বেস অফ দ্য ব্রেন, এটাকে থার্ড ভেন্ট্রিকলটাকে বোঝাবার জন্য এটা করেছে। দেখো ইন বিটুইন উই আর গেটিং দ্য থার্ড ভেন্ট্রিকল, দেখো বুঝেছো? দ্য বেস অফ দ্য ব্রেন, হ্যাঁ এদেরকে মিড ব্রেন দেখতে পাচ্ছ, এখানে তোমার এই যে ট্র্যাকটা হচ্ছে অ্যাকুইডাক্ট অফ সিলভিয়াস, তাহলে উপরের যে পার্টটা হবে থার্ড ভেন্ট্রিকল, in between আমরা getting the third ventricle বুঝছো lateral ventricle third ventricle actually third ventricle তোমরা এখানেই দেখতে পেয়ে গেছো কোথায় বলো তো কোথায় দেখতে পেয়েছো এর মধ্যে this is the এই third ventricle হয় এই third ventricle in between two ventricle দু মানে cerebral hemisphere এখানে একটা cerebral hemisphere এদিকে একটা cerebral hemisphere ঠিক আছে তাহলে in between we are getting the third ventricle okay this is the area of the third ventricle okay so this is the third ventricle okay and in the lateral surface of the third ventricle we can find hypothalamus below and thalamus here and interthalamic adhesion